Again, well, earlier we talked about kids having to deal with a lot these days. So sometimes that might require treatment from professionals, but getting them there comes with some challenges. Unison Health has a newer service that might help. And with us this afternoon is Megan Reinhardt and Veronica Laverde with Unison. Thanks for being here today.
Thank you for having us.
Yeah, this is actually brand new. This is something that you're going to be launching, what, next week?
Yes.
Wednesday. So, okay, what is it?
It is the IHBT program. It stands for Intensive Home-Based Treatment. It's this new model that we have where we go into the homes where our real focus is keeping families together and stabilizing the family so kids can stay safely with their families.
Okay, so this treatment's going to happen inside the house?
Yes.
Okay, talk a little bit about the need here in our community.
Yeah, so this really helps us to fill a gap in our continuum of care of services available for kids. So there's outpatient therapy where they maybe go to an office location to see a therapist, and this helps give us an additional level to that for maybe those higher intensive needs that they can receive those services right in their home.
Okay, yeah, let's talk about the circumstances here under which a family might qualify for something like this or be a good candidate.
Sure. Some of our families have children that are having a hard time being safe in the home, and that might mean, you know, they have some self-harm behaviors. Or maybe they've been aggressive with family members or things like that. Or maybe they're involved in the juvenile justice system, have truancy issues, things like that, where families don't really feel like they have the skills to safely keep them there. And then they're put in this tough situation of like, what do I do? And how do I help my child? I've tried all these other things and they're not working. So what options do I have at this point without putting my child into some other higher level of care like a hospital or residential or things like that?
So, and as you said, you want to keep the families together.
Yes.
You know, that's the whole goal here. So how would somebody go about applying or getting connected, those types of things?
So they could go to our website, unisonhealth.org, to learn more. We have additional information listed on there, but they would go through a process to become a Unison client and get enrolled in the program, and that would give them a licensed therapist and a case manager that would become their treatment team that would provide those services in the home or school or in the community.
Yeah, how intensive is this? Is this somebody that comes by, pops in, you know, once a month or something, or is this, you know, we're going to be there a couple times a week?
This is definitely the be there a few times a week.
Okay.
In addition to a therapist and a case manager spending multiple hours with a family a week, we also offer 24/7 crisis on call for these families. So if it's after hours and they're having an issue and they're just like, we don't know how to navigate this, they can call us and they will get an IHBT provider to support them who can support their family right where they are.
You know, we were just chatting a bit about what teenagers, kids, you know, this Gen Z, they grew up with phones and social media, and we've seen some depression and anxiety too. So talk a little bit about, you know, what the challenges are when it comes to mental health and adolescence.
So yeah, we're definitely seeing an increase in depression and anxiety. There's also, kids are experiencing a lot of trauma, and so they may not always have the skills or the ability to manage those emotions or manage those behaviors. And so thankfully with Unison, we're able to offer a wide variety of services for kids, and this is just going to be another benefit that we can help support those families with.
So this is funny that you all recently received. Is this a pilot, or is this something that can continue? What do we think?
Hopefully it will continue.
Yeah.
We did receive grant funds to help get us started, but the goal is that this will be an ongoing program for kids not only in Lucas County, but also for our 4-county area.
Oh, okay.
So it's Defiance, Fulton, Henry, and Williams counties as well.
Wow, okay, so you all will be covering quite a large area.
Yes.
But, you know, how important is it for families to get connected to mental health treatment?
Oh, it's incredibly important. We see incredible need. You know, kids are disconnected. You know, right now, even though they have something in there. They're steeped in phone connection, but really we're seeing that they're disconnected, and their mental health needs are not being met just by some of the traditional methods that we would have to support children. And so it's more important than ever that if families feel like their child needs some help, that they call their local mental health provider and get them in for an assessment.
help is out there, right?
Yes.
It's out there.
And
yes.
this is a brand new program getting started next week. So again, tell families where they can go to get the information.
So they can go, if they want to learn more about this service or other Unison services, they can go to unisonhealth.org/IHBT.
Okay, and then we've got the phone number there too. Ladies, thank you so much for being here today.
Thank you so much for
Thank you
having
for
me.
having us.
Yeah, it sounds like a great program. Thanks.